Good afternoon, everyone. So my name is Yowali Kabamba, and I am working with the European Health Management Association in Brussels. And together with 14 partners, we're partnering on a European project, which is called eHealth. At the moment, we are in the second part of the project, which is about to produce some online classes to improve digital health literacy in Europe. So this afternoon, I will start by explaining what digital health literacy actually is, and then explain a bit more about the project in itself, then present the 14 partners that are working on it. Then I will explain the objectives and the approach. Quickly mentioning the survey that we conducted earlier this year, but I will not go into detail about it because my colleague is going to present the results of it in the second part of this session. Then I will talk about the co-creation process and how we aim to create these online classes. We actually want to involve citizens from specific target groups. And as such, we have decided to create communities of practices so that it could reflect the needs and the wants of citizens. And finally, you will have all the contact information available if you want more information. So digital health literacy refers to the ability to seek, find, understand, and appraise health-related information from electronic sources and to apply the knowledge gained by making appropriate health decisions in order to address or solve a health problem. So basically what it means is that as an individual, we want you to be able to go online, to find the information you're looking for, to understand what's written, to be able to then understand how you can apply this information for your personal needs, and then change your behavior accordingly. So in today's connected world, as we've seen, digital health literacy has become a very important part of health management. And there have been a lot of talks about how we can empower citizens, how they can become more involved in their health. But to do that, they need to be able to understand the terms and to understand what health professionals are telling them. So basically what eHealth, which is our project, aims to do is to empower citizens and the population in Europe to reduce health inequalities and to help them develop the necessary skills to make proper informed health decisions. So eHealth is a project that aims to develop a series of massive open online courses, or also called MOOCs, to help improve digital health literacy. So the countries involved in the pilot are Belgium, Denmark, Germany, Italy, the Netherlands, Spain, Sweden, and the United Kingdom. So what it means is that partners from all these countries came together and decided to develop these MOOCs not only in English, although we know that a lot of people master this language. We actually wanted to make it as available as possible, as understandable as possible for a lot of European citizens. So we decided to translate those courses in 8 languages. So the project brings together a lot of different partners, and we wanted to focus on specific target groups that we believed would have more difficulties in understanding health information online. So we're working with 5 target groups, which are children, adolescents, pregnant and lactating women, elderly people, and people affected by diabetes type 1 and type 2. Why we picked these groups is pretty simple, is that because we believe that each of these groups are vulnerable for specific issues concerning digital health literacy, and that by taking all of these groups together, we can create actually a comprehensive ensemble of MOOCs that would cover all the skills necessary for any kind of people in the population. So more technical details. The eHealth Consortium consists of 14 partners from 7 different countries. We have 7 universities and research centers, 1 public authority, 2 SMEs, 1 hospital, 1 NGO, and 2 European networks. So our objectives are, we have actually 4 objectives. We want to achieve IT literacy, the digital literacy, because people that cannot use computers or that cannot use phones or apps will not be able then to use, to search for health information. That will be the first challenge that we want to overcome. Then we want to achieve health literacy. So it means how do people and citizens, how do they understand what's written? Can they actually comprehend what it means to have a specific issue? Or can they use the right terms, medical terms? Then we want to help them actually determine if the information that they find online is trustworthy. Because as we know, there are a lot of information available, and there are not specific guidelines as to if that information that I found on this website is actually the truth or not. And then we want them to be able to use that information and to make informed decisions for their health. So our approach was pretty straightforward. So at first we decided to do an analysis of the current health and digital health literacy level of the population. So we conducted a survey among the 8 countries that were present in, and that would be the second part of our session, where we will present the results that we found. Then we decided to engage the population, so to try and find representatives of these 5 groups that I talked about earlier, so that they could give us their inputs and their worries and needs, so that we can include that into our project. Then the next phase will be to actually create together with this representative of citizens these MOOCs, so that we can really include and incorporate every aspect of health management into it. And finally, those MOOCs will be made available online for free, so that any citizens, regardless of where they are, can access and improve their skills. So co-creation, it is the key word of eHealth. This is what we've based our project on. What we mean by that is that we want people, citizens, to work with health professionals, with European networks, so that they can actually have an equal say into what they want to see in those MOOCs or in those courses. We are going to do that in 2 ways. First of all, we have offline communities of practices that have been established now. And basically, we will create we will participate in 2 or 3, depending on where you are, activities, offline activities, where we will work together to determine what we want to see in the MOOCs and what it's going to look like, which includes not only the specific topics, but also whether we want a video, if we want a text, if we want an article, if we want infographics. Everything will need to be decided with the citizens. And then we have an online community, which is on a specific platform, so that citizens that are not able to actually come to these meetings will be able to participate even more by giving their inputs and their IDs in their specific section. So that means that this platform is actually divided between countries and also between cohorts, so that a child from Belgium will be able to go to that specific forum and give his input on that specific MOOC. So, yeah. Yep. So to go back to the offline communities, each target will be mobilized in communities of practices, and so each of these groups will create 1 MOOC. So then in total we will have 30, it's written 35, but we've raised it to 36 MOOCs. Each CUP will have 2 or 3 offline meetings, as I said, and it can take any form, really. We are actually pretty open about how we want to organize those meetings. So some partners would rather create workshops. Others will have roundtables or a different format. All that matters is that inputs are given from both health professionals and citizens, and then in the end we are able to create one of those MOOC. The communities of practice in particular are spontaneous phenomenon among people who share common interests and passion, and you meet to learn from each other. So it actually is a bit different from workshops because it's really based on continuity and a social network. So this is a timetable of our project. We've started actually in November 2016, but now we are on the second phase, as I've said, which is the community of practice activities. So we are recruiting and establishing the COPs right now. Well, it's coming to a close. And we are about to launch this web-based community platform. Then from this month until March, we are having these offline sessions where we're going to create the MOOCs, and we are having these also focus groups to help further in our work. And then from May 2018 onwards, we are going to, well, our partner, the University of Tallinn, is going to develop the MOOC, and which will be then sent back to us, so we will be able to test it, see everything function, maybe fine-tune it if necessary, which will then be put online for everyone to use. So co-creation activities in motion, because it actually started already with a few of our partners, and we have been lucky enough to receive some pictures. So there have been, was the first workshop organized by our Spanish partner with diabetic patients. And they were able in 3 hours to co-create, to not only discuss digital health literacy, so what it means and what are the necessary skills, but they were also able to decide together what they wanted to put in the MOOC. And it was a really lively exchange, and now they are able to send a template filled out with all the information that they want to see in the MOOC to Tallinn University, who will then be able to develop it. I assume that as a lot of people are involved in IT, almost everyone will know what a MOOC is, and I've mentioned it quite a lot, and I've said that it was an online course, but more specifically, MOOCs are free, open, and accessible to anyone. And basically what it means is that there is no prior knowledge needed, so you don't necessarily have to have any medical background or IT background to be able to take those courses. It's free, as I said, really easy access. It will be available in 8 EU languages, so English, Spanish, Italian, French, Swedish, German, Dutch, and Danish. And it will be hosted on different platforms and also available through a mobile app. So this is it. This is our contact information. If you're interested in the project or if you would want to know more about it, we will be more than happy to discuss it, because the more people know about it, the better, of course, for us and for all the citizens involved. Thank you very much.